Hi, my name is Eileen Lydon. I'm a nurse practitioner. I work at NYU Hospital, and I've been practicing in rheumatology for 23 years. Today, for Journal Club, I will be reviewing an article entitled The Challenge of Hypophosphatasia Diagnosis in Adults and Results from the HPP International Working Group Literature Surveillance, which was published in Osteoporosis International in 2023. So first off, I'd just like to define HPP. It is a rare genetic bone disease characterized by a low alkaline phosphatase, and it's caused by a reduced or absence activity of the tissue non-specific alkaline phosphatase enzyme, which is due to pathogenic variants in the alkaline phosphatase gene. Now, the tissue nonspecific alk-phos enzyme is a crucial enzyme, and it's found in many tissues, especially bone, kidney, and liver. And it's responsible for breaking down phosphate compounds to enable bone and teeth mineralization, nerve function, and controlling inflammation. So therefore, the reduced or absent activity can lead to clinical manifestations. And as per the title of the article, we will be discussing HPP in adults, and the prevalence of this is yet unknown. It's partially due to the lack of disease awareness, its diverse presentation, and that it actually may show up later in life. And the signs and symptoms may be mild and non-specific. So, for example, a patient may present with just dental complications, maybe premature tooth loss or just periodontal disease, but without any evidence of skeletal or other organ involvement, which can make the diagnosis challenging. And unfortunately, the diagnosis of HPP is often delayed by approximately 10 years after the onset of some symptoms. So identifying patients early is certainly an unmet need. And the wide spectrum of symptoms and clinical manifestations, they have been inconsistently associated with HPP in adults. There's a huge variety of them. Some examples include fragility fractures, short stature, joint and muscle pain, altered gait, pseudogout, kidney stones, daily headaches, and depression. So better recognition of this condition is crucial, as you can see, and this would reduce the time required to establish a diagnosis of this disease. So in this article, the HPP International Working Group, this group consisted of HPP experts, and they were selected on the basis of their expertise and publications in the field and had at least 5 years of experience in the management of adult patients with HPP. And this group was formed in order to critically analyze the challenges and unmet needs through a review of the literature and an opinion of the clinical experts, with the aim to create specific diagnostic guidelines for HPP in adults. So first off, a review of the literature was conducted by searching several online research platforms, including Medline and others. And this started in January of 2005 and went through September of 2020 using hypophosphatasia and HPP as keywords. And papers, they were considered eligible if they addressed the diagnosis of HPP as well as the diagnostic characteristics present or likely to be present. So let's review the results. So of the 1,541 publications that were identified, only 119 proved eligible after review. And of the 119, 58 were identified as reporting diagnostic lab features and clinical manifestations of HPP. And subsequently, 17 diagnostic characteristics of interest were then identified. So of these 17 characteristics, only 2 of them were present in greater than 70% of the studies, which included the presence of pathologic or likely pathologic rare variants of the ALK-Phos gene and the elevation of natural substrates of the tissue nonspecific ALK-Phos. And all the other findings were reported as less than 30% on all the studies that were analyzed. So pooled prevalence was then assessed of each of the 17 diagnostic criteria. So this involved combining data from multiple studies to get a more accurate prevalence of a condition. And based on these results, diagnostic features were initially classified as major with a pooled prevalence of greater than 50% and minor with a pooled prevalence of less than 50%. So in all, there were 6 major and 11 minor diagnostic criteria that were identified. But after further analysis and consideration, the working group prioritized 4 diagnostic criteria for inclusion as major and 5 as minor. So this now leads us to the final outcome of the study. The findings recommend an adult with a low alkaline phosphatase. They need to meet 2 major or 1 major and 2 minor criteria for the diagnosis of adult HPP. The major diagnostic criteria for HPP in adults include an elevated alkphos gene variant, elevation of natural substrates of the tissue nonspecific alkaline phosphatase enzyme, atypical femur fractures, or recurrent metatarsal stress fractures. As far as the minor diagnostic criteria for HPP, they are poorly healing fractures, chronic musculoskeletal pain, early atraumatic loss of teeth, chondrocalcinosis, or nephrocalcinosis. So now, I also just wanted to point out a couple of the strengths and limitations of this study. The strengths include a comprehensive literature search with knowledge and expertise of international experts and specialists in the field of HPP. Also, during data abstraction, the classification of diagnostic characteristics were performed through independent judgment of 2 expert reviewers, and any potential conflicts were resolved by a 3rd independent reviewer. A couple of the limitations. Limitations were that the clinical data from case reports and case series were not always collected at the initial visit and follow-ups as they would be in a prospective study. So, and therefore, that data may be missing. Also, some adult patients with HPP that had reported symptoms perhaps during childhood, but then this diagnosis was made later in life. Perhaps these clinical features may have not been reported to the clinicians, resulted in an underestimation of the real prevalence in patients. So, in summary of this article, a diagnosis of adult HPP remains a challenge due to the high variability of the symptoms, the non-specific presentation that may overlap with other metabolic bone diseases, as you can see, and the low levels of HPP awareness among clinicians. So no single sign or symptom has been demonstrated to be universal in patients with HPP. No formal diagnostic guidelines have historically existed for the diagnosis of HPP. However, this review of the literature by HPP Working Group highlighted key diagnostic characteristics of HPP in adults, which now have led to the development of some major and minor diagnostic criteria. So this is certainly a much needed classification that we can use in our clinical practice. But further studies will be needed to verify the accuracy of this diagnostic approach. So this concludes this journal club, and I thank you for your time and attention today. And please feel free to download the RhAPP ACE app for further information.